Vomiting, Wikipedia audio. Vomiting, also known as emesis, puking and throwing up, among other terms, is the involuntary, forceful expulsion of the contents of one's stomach through the mouth and sometimes the nose. Vomiting can be caused by a wide variety of conditions. It may present as a specific response to ailments like gastritis or poisoning, or as a nonspecific sequela of disorders ranging from brain tumors and elevated intracranial pressure to overexposure to ionizing radiation. The feeling that one is about to vomit is called nausea, which often precedes, but does not always lead to, vomiting. Antiemetics are sometimes necessary to suppress nausea and vomiting. In severe cases, where dehydration develops, intravenous fluid may be required. Self-induced vomiting can be a component of an eating disorder, such as bulimia nervosa, and is itself now an eating disorder on its own, purging disorder. Vomiting is different from regurgitation, although the two terms are often used interchangeably. Regurgitation is the return of undigested food back up the esophagus to the mouth, without the force and displeasure associated with vomiting. The causes of vomiting and regurgitation are generally different. Complications. Vomiting can be dangerous if the gastric content enters the respiratory tract. Under normal circumstances, the gag reflex and coughing prevent this from occurring. However, these protective reflexes are compromised in persons under the influences of certain substances such as alcohol or anesthesia. The individual may choke and asphyxiate or suffer an aspiration pneumonia. Prolonged and excessive vomiting depletes the body of water, and may alter the electrolyte status. Gastric vomiting leads to the loss of acid and chloride directly. Combined with the resulting alkaline tide, this leads to hypochloremic metabolic alkalosis and often hypokalemia. The hypokalemia is an indirect result of the kidney compensating for the loss of acid. With the loss of intake of food, the individual may eventually become cachectic. A less frequent occurrence results from a vomiting of intestinal contents, including bile acids and HCO(3), which can cause metabolic acidosis. The chemoreceptor trigger zone at the base of the fourth ventricle has numerous dopamine D2 receptors, serotonin 5-HT3 receptors, opioid receptors, acetylcholine receptors, and receptors for substance P. Stimulation of different receptors are involved in different pathways leading to emesis. In the final common pathway substance P appears involved, the vestibular system, which sends information to the brain via cranial nerve 8, plays a major role in motion sickness, and is rich in muscarinic receptors and histamine H1 receptors. The cranial nerve X is activated when the pharynx is irritated, leading to a gag reflex. The vagal and enteric nervous system inputs transmit information regarding the state of the gastrointestinal system. Irritation of the GI mucosa by chemotherapy, radiation, distension, or acute infectious gastroenteritis activates the 5-HT3 receptors of these inputs. The CNS mediates vomiting that arises from psychiatric disorders and stress from higher brain centers. Repeated or profuse vomiting may cause erosions to the esophagus or small tears in the esophageal mucosa. This may become apparent if fresh red blood is mixed with vomit after several episodes. Recurrent vomiting, such as observed in bulimia nervosa, may lead to destruction of the tooth enamel due to the acidity of the vomit. Digestive enzymes can also have a negative effect on oral health, by degrading the tissue of the gums. Receptors on the floor of the fourth ventricle of the brain represent a chemoreceptor trigger zone, known as the area post-rema, stimulation of which can lead to vomiting. The area postrema is a circumventricular organ and as such lies outside the blood-brain barrier. It can therefore be stimulated by blood-borne drugs that can stimulate vomiting or inhibit it. There are various sources of input to the vomiting center. The vomiting act encompasses three types of outputs initiated by the chemoreceptor trigger zone: motor, parasympathetic nervous system, and sympathetic nervous system. They are as follows. Increased salivation to protect tooth enamel from stomach acids. This is part of the PN's output. The body takes a deep breath to avoid aspirating vomit. Retroperistalsis starts from the middle of the small intestine and sweeps up digestive tract contents into the stomach. Through the relaxed pyloric sphincter, intrathoracic pressure lowers, coupled with an increase in abdominal pressure as the abdominal muscles contract, propels stomach contents into the esophagus as the lower esophageal sphincter relaxes. The stomach itself does not contract in the process of vomiting except for at the angular notch, nor is there any retroperistalsis in the esophagus. Vomiting is ordinarily preceded by retching. Vomiting also initiates an SNS response causing both sweating and increased heart rate. The neurotransmitters that regulate vomiting are poorly understood, but inhibitors of dopamine, histamine, and serotonin are all used to suppress vomiting, suggesting that these play a role in the initiation or maintenance of a vomiting cycle. Vasopressin and neurokinin may also participate. The vomiting act has two phases. In the retching phase, the abdominal muscles undergo a few rounds of coordinated contractions together with the diaphragm and the muscles used in respiratory inspiration. For this reason, an individual may confuse this phase with an episode of violent hiccups. In this retching phase, nothing has yet been expelled. In the next phase, also termed the expulsive phase, intense pressure is formed in the stomach brought about by enormous shifts in both the diaphragm and the abdomen. These shifts are, in essence, vigorous contractions of these muscles that last for extended periods of time, much longer than a normal period of muscular contraction. The pressure is then suddenly released when the upper esophageal sphincter relaxes, resulting in the expulsion of gastric contents. Individuals who do not regularly exercise their abdominal muscles may experience pain in those muscles for a few days. The relief of pressure and the release of endorphins into the bloodstream after the expulsion causes the vomiter to feel better. Gastritis, gastroenteritis, gastroesophageal reflux disease, celiac disease, non-celiac gluten sensitivity, pyloric stenosis, bowel obstruction, overeating, acute abdomen and/or peritonitis, ileus, food allergies, cholecystitis, pancreatitis, appendicitis, hepatitis, food poisoning. In children, it can be caused by an allergic reaction to cow's milk proteins. Aspiration. Gastric secretions and likewise vomit are highly acidic. Recent food intake appears in the gastric vomit. Irrespective of the content, vomit tends to be malodorous. The content of the vomitus may be of medical interest. Fresh blood in the vomit is termed hematemesis. Altered blood bears resemblance to coffee grounds and, when this matter is identified, the term coffee ground vomiting is used. Bile can enter the vomit during subsequent heaves due to duodenal contraction if the vomiting is severe. Fecal vomiting is often a consequence of intestinal obstruction or a gastrocolic fistula and is treated as a warning sign of this potentially serious problem. If the vomiting reflex continues for an extended period with no appreciable vomitus, the condition is known as non-productive emesis or dry heaves, which can be painful and debilitating. Vomiting may be due to a large number of causes, and protracted vomiting has a long differential diagnosis. Causes in the digestive tract. Causes in the sensory system. Causes in the brain. Dehydration and electrolyte imbalance. Mallory-Weiss-Tier. Metabolic disturbances. Movement, motion sickness, Meniere's disease. Dentistry. Pathophysiology. Phases. Contents. Differential diagnosis. Pregnancy. Concussion, cerebral hemorrhage, migraine, brain tumors, which can cause the chemoreceptors to malfunction, benign intracranial hypertension and hydrocephalus. Drug reaction. Hypercalcemia, uremia, adrenal insufficiency, hypoglycemia, hyperglycemia. Illness. Hyperemesis, morning sickness. Digestive tract. Psychiatric/behavioral. An emetic, such as syrup of ipecac, is a substance that induces vomiting when administered orally or by injection. An emetic is used medically when a substance has been ingested and must be expelled from the body immediately. Inducing vomiting can remove the substance before it is absorbed into the body. Ipecac abuse can cause detrimental health effects. Salt water and mustard water have been used since ancient times as emetics. Care must be taken with salt, as excessive intake can potentially be harmful. Copper sulfate was also used in the past as an emetic. It is now considered too toxic for this use. Hydrogen peroxide is used as an emetic in veterinary practice. It is quite common that, when one person vomits, others nearby become nauseated, particularly when smelling the vomit of others, often to the point of vomiting themselves. It is believed that this is an evolved trait among primates. Many primates in the wild tend to browse for food in small groups. Should one member of the party react adversely to some ingested food, it may be advantageous for other members of the party to also vomit. This tendency in human populations has been observed at drinking parties, where excessive consumption of alcoholic beverages may cause a number of party members to vomit nearly simultaneously, this being triggered by the initial vomiting of a single member of the party. This phenomenon has been touched on in popular culture. Notorious instances appear in the films Monty Python's The Meaning of Life and Stand By Me. Intense vomiting in ayahuasca ceremonies is a common phenomenon. However, people who experience la purga after drinking ayahuasca, in general, regard the practice as both a physical and spiritual cleanse and often come to welcome it. It has been suggested that the consistent emetic effects of ayahuasca, in addition to its many other therapeutic properties, was of medicinal benefit to indigenous peoples of the Amazon, in helping to clear parasites from the gastrointestinal system. Sensory system and brain. There have also been documented cases of a single ill and vomiting individual inadvertently causing others to vomit, when they are especially fearful of also becoming ill, through a form of mass hysteria. Most people try to contain their vomit by vomiting into a sink, toilet, or trash can, as vomit is difficult and unpleasant to clean. On airplanes and boats, special bags are supplied for sick passengers to vomit into. A special disposable bag containing absorbent material that solidifies the vomit quickly is also available, making it convenient and safe to store until there is an opportunity to dispose of it conveniently. Alcohol, opioids, selective serotonin reuptake inhibitors, many chemotherapy drugs, some entheogens. Emetics. People who vomit chronically may devise various ways to hide this disorder. Norovirus, swine influenza. An online study of people's responses to horrible sounds found vomiting the most disgusting. Professor Trevor Cox of the University of Salford's Acoustic Research Center said that we are pre-programmed to be repulsed by horrible things such as vomiting, as it is fundamental to staying alive to avoid nasty stuff. It is thought that disgust is triggered by the sound of vomiting to protect those nearby from possibly diseased food. Bulimia nervosa, purge disorder. Social cues. Miscellanea. Other types. An antiemetic is a drug that is effective against vomiting and nausea. Antiemetics are typically used to treat motion sickness and the side effects of medications such as opioids and chemotherapy. Antiemetics act by inhibiting the receptor sites associated with emesis. Hence, anticholinergics, antihistamines, dopamine antagonists, serotonin antagonists, and cannabinoids are used as antiemetics. Evidence to support the use of antiemetics for nausea and vomiting among adults in the emergency department is poor. It is unclear if any medication is better than another or better than no active treatment. Nausea and/or vomiting are the main complaints in 1.6% of visits to family physicians in Australia. Herodotus, writing on the culture of the ancient Persians and highlighting the differences with those of the Greeks, notes that to vomit in the presence of others is prohibited among Persians. Treatment. Epidemiology. Social and cultural aspects.